Just to give a brief intro, as Cole mentioned, I'm David Sturtz. I've been with Geographic for just 14 years last week. And so been in the healthcare space for quite a while and seen a lot of transitions and changes. And we'll be talking through a lot of those today as it relates to the idea of the provider directory and the overall concept of patient access. So we'll be taking kind of a broad view around those topics, and really wanted to start out just defining the idea of patient access and then using that for a little bit of structure to walk through some different angles of how your digital presence can really better support healthcare consumers in getting engaged with your organization, using your services, connecting with your physicians, and all of those kinds of things. So to start out, I'm going to define patient access today as kind of the process of enabling healthcare consumers to find and receive appropriate, timely, and convenient care. So what we're going to talk through a little bit today is starting out with that consumer angle. Where are consumers at today? What's going on? Some trends and some factors that are really coming together as they engage with healthcare organizations. What's the process of finding? This is where we'll get into the provider directory as being a key piece of how they find the physicians and care providers to engage with. So we'll touch on that. We'll talk about the idea of what is appropriate care and what does timely care mean to a healthcare consumer. And finally, the kind of sticky area of what makes something convenient. And so we'll touch on all of those areas. So to dive right in, I'm going to start in the area of healthcare consumers. And one of my favorite slides I've been using for a while, I think this just does a fantastic job at some data from Kaufman Hall around outlining the internal versus the external view of the healthcare experience. On the left-hand side, you have a lot of what inside the healthcare organization people have said is important. What are the competitive differentiators as people talk about that inside of the building, so to speak. And then on the right-hand side, what is it the consumers actually say that they want out of this? And you can see, of course, they don't line up. No real surprise there. A lot of times what we think are our strengths inside of healthcare are not necessarily the things that are top of mind for consumers. But what I think is really interesting as we're talking about patient access today, right there at the top, accessibility of care. That's what consumers, value most based on this data. And we'll walk through a little bit of what that exactly means. But I wanted to also call out the next three items kind of as a group, and want to kind of carry those items through this conversation. So as we're thinking about item number one, accessibility of care throughout the conversation today, keeping in mind 2, 3, and 4 around consumer experience, the quality of clinical outcomes, and the overall value provided. So you can see those are top of mind for healthcare consumers. And those actually make up kind of the three legs of the stool that we think about around transparency. So again, it's that experience. What does that care experience look like? What do I actually end-to-end experience as a patient outside of even the actual doctor's office? What is that overall experience of care for me? What is quality in how I perceive that as a consumer? And experience can often factor into that a lot. It may have been, I may have gotten healthy, have had my procedure, it came out flying colors, but I just didn't like that doctor. I didn't like that nurse or the front desk staff. My perception of the quality of that is going to be adversely affected by all that entire experience. But also looking at, really what were the outcomes? What was the effect of the care that I got? And then finally, that price area. And that's really kind of a tricky area, and we'll talk a little bit more about what's going on in that space right now as well. But more and more attention being paid by consumers to that price tag that goes along with the care. And it's a challenge for healthcare organizations today, the way that the things are structured, to really be able to solidly answer that question. We're making progress there, but it's something to keep in mind. So thinking through all of these areas, I wanted to call it a few places where healthcare organizations, we're seeing a lot of folks dig in on these and push this forward. One over the last several years has been that patient experience. And so this is just one area where that filters through in the ratings and reviews on physician profiles, adding that into the provider directory on the website, making sure that that's on the profile, having those full verbatim reviews in there, as well as that overall star rating. And as that has really grown in adoption, just seeing really great results from that for healthcare organizations, and tons of data just in general in the online marketing space around consumer reviews and how important that is. Numbers like 70% of consumers read at least 4 reviews before they're going to trust a business. So it has really infiltrated the overall consumer experience, not just in healthcare, but across the board. If you look up a local business and you see one with even a handful of 4 or 5 star reviews and another one with none, a lot of us are really drawn towards being able to go towards that business that we see people have had good experiences at. So this is just one way that it has, that consumer trend has really woven its way into the provider directory and the overall experience of patient access. Quality is another area, and this is something I know at Geographic we've worked on for a long time. We've helped clients really try to communicate what is that quality data. We have some of those more kind of boring reports around Joint Commission or Medicare's data around hospital quality. How do we communicate that in a way that's compelling to consumers? How do we weave that into our overall content approach in a benefit-driven way? And it's important, I think, when you're thinking about quality, again, it's some of that internal language versus the external language. What is it that, maybe on some of those formal reports versus what is it that consumers are really looking for, what speaks to them in quality? And so in addition to having maybe a center on your website around quality, a lot of organizations have done a lot of work to weave this into the overall messaging, finding out what quality care means for different service lines, and weaving that into the overall benefit-driven messaging for those areas. The last trend we've really seen some interesting things happen with in the last year is price. And I'm sure many of you have followed kind of the saga of the proposal to have more price transparency from hospitals, the AHA's lawsuit around trying to block that, and that going to appeal a couple of months ago as well. So that seems to be an ongoing saga, but in the meantime, most healthcare organizations are really looking at how can we do this? How can we start to get more information in the hands of consumers? We have a number of clients that are working with tools through Epic's patient portal to allow patients to get estimates for their upcoming care. And a lot of areas that healthcare organizations are just digging into, kind of regardless of the legal side of it, how things are actually going to play out or what those requirements are going to be. It's pretty clear that consumers really want this information. More and more of the healthcare dollars are sort of inside of their control as people have moved to higher deductible plans and things like that. There's a lot of need for consumers to have some control over where those dollars are going and have some insight into what's going to happen. And so this is definitely an area that organizations are pushing forward with and thinking through, how do we weave that message together? How do we not only put a dollar sign in front of the consumer, but tie it into all of these other areas of transparency to help them make a more informed choice? One of the other trends I wanted to highlight is just the overall competitive landscape. And we've talked a lot about this on our own webinars and in all kinds of conversations, but looking back, 10 years ago, it was a lot of your health system versus the competitor down the street. And there's a huge overlap there between the services that your health system offered and another similar health system. And I think the trend that we're seeing, just kind of visualize it here, is there's a whole bunch of new entrants. And what's interesting about those new entrants is a lot of them take just one piece of what has been the health system's business in the past, and they're really focused nationally at a large scale on that one piece. And in doing so, they're able to really focus on the problems of access and transparency in a way that is different than what health systems have traditionally been able to do. And it really is putting a lot of pressure, I think, on health systems to tackle those problems, to be competitive in all of those spaces, and to think through, how they can match the bar that these organizations that have vast consumer experience in other areas, uh, that bar that they're setting for that overall patient experience. I wanted to touch on the COVID-19 situation as well, um, and just bring in a little bit of data around what seems to be going on with consumers there. And this data that I've pulled in is really broad. It's not just healthcare consumers, but it's some trends that are across consumers in general, and I think have some interesting implications for healthcare as well. Though basically, what we're seeing is some of the trends that were out there before around consumer choice, around brand switching, around going online and wanting to interact digitally, seem to be amplified and accelerated based on people being more reluctant to leave their homes, engaging through virtual care and through online means as necessary, just because of closures and the availability of different kinds of facilities at different points during the pandemic. Outside of the healthcare space, this is some data from McKinsey that touches on the switch from towards online purchasing. So seeing 15 to 30% growth across categories in terms of consumers that have moved towards online for purchasing a variety of products and services. And this goes back to that idea that it's the entire consumer experience that is setting the bar. And it's not just healthcare, it's all of those things. If I can go online and get my groceries, it starts to change my perception of what's possible for my healthcare and how I prefer to interact with organizations. So definitely something that I think we're probably all experiencing and engaging with as sort of participants, I guess, in this pandemic, but definitely some data around that switch. And alongside of that, and again, something I think we've probably all experienced, but it's good to have some numbers to back that up. Lots of brand switching and changes in kind of loyalty there. So people are choosing new brands, new products based on availability, convenience, value. Those sound pretty familiar. They're the things we're talking about around patient access. And I think it really opens up a little bit of risk for health systems where if we're not able to effectively communicate that availability, the convenience, the value of our product offerings, what we're seeing is as people in other spheres are willing and ready to switch, to try something new, to go for the thing that is in stock today, that they can get their hands on, give it a try, and what the long-term effects of that might be are yet to be seen. So that's just a little bit around where healthcare consumers are at in this whole question around access. I'm going to switch gears a little bit and move over to the process of helping them find information, particularly around the care provider. And as we think about the provider directory, this is a really interesting aspect of your overall web experience and your digital experience and your overall digital brand. This is that entry point where consumers start to make a personal connection, a human-to-human connection with your brand. And it's really, I think, an opportunity to have a compelling experience. And really, I hear healthcare organizations talk all the time that our people are our brand, that their care providers, their frontline staff really represent their brand. And so the provider directory is really where that comes to life online. And it's something important to consider as you're thinking through your overall strategy. We also see a lot of challenges with provider directories. And I think everybody on the call can probably sympathize with some of these. It's a high focus area on the website. It gets a lot of attention from a lot of people that have a stake in that provider directory. Some of the themes that we tend to see as we've worked with dozens of clients over the years on their provider directories is the overall strategy can be a challenge, and just clarifying that and starting out and really understanding what is your physician strategy? How are you going to handle and prioritize different kinds of physicians, whether they are employed, whether they are community or referring physicians? What does that strategy look like? It has implications for how things come together into that web experience. Understanding the brand strategy that goes along with that. You know, are we going to promote this clinic or that clinic, this sub-brand or that sub-brand differently? How are we going to communicate all of those brand aspects through the provider directory? And then the governance aspects. Who owns this data? Who gets to make decisions? Who gets included in this directory? Some of those high-level pieces, as well as just how is it going to be updated and maintained, and what's the timeliness around that? We see a number of struggles around content, of course, usually starting from the data side. Where do we even begin? Who are the providers, and what is the basic information about them that we want to include in this directory? And then it goes into the content creation and maintenance. On top of some baseline data, most organizations struggle to maintain a deep marketing database around all of the content that really supports a provider, whether that's you know, the biography or video or just details about the services that they provide. Usually there are layers that we need to present to the consumer that may not exist anywhere else. And so that is a struggle that we see time and again of how are we going to assemble that information, maintain it, and present it. And then I included the call to action in here as well. A lot of times we create these giant catalogs of providers on the website, and there's no way to order one. We can't go in and click buy now on any of them. And so really we're looking more and more, and some of the options and things we'll look through today are definitely moving the right direction. But thinking through, what do we want consumers to do when they see this profile? How can they best take action? What are the variety of ways that a consumer can engage with this particular physician, and how do we guide them down the right path? Finally, findability is a huge piece. And I think when I've looked at healthcare sites where organizations are struggling with their provider directory, this is one of the areas that I think is you know, a large impact on the overall marketing effectiveness, and sometimes is a little bit invisible. So that's everything from the search features of the directory itself. How can consumers go through and narrow down that list of hundreds or thousands of providers to find the handful that would be a really good match for them and their needs? But it goes as well into having an integrated UX, taking that user experience not just into the provider directory, but through a number of different access points coming in from service lines or particular procedures or conditions, all the way through the locations of care, and making sure that all of those dots are connected in ways that create a cohesive user experience across the entire website. And finally, the SEO aspects are huge. And I've seen time and again provider directories just, you know, different problems that are created on a technical level that prevent individual physicians from being indexed in the search engines, that just do not allow them to be fully optimized in the way that they should be. So that's something that is definitely a piece of getting those providers found, getting them in front of consumers, and needs some attention. Overall, what we see is that the provider directory has to be a real balance of structure and flexibility. And so as we approach that, there's a number of things that need to be very structured, that need to really support the search and browsing and interconnected experience, but then really open up the door for you as an organization to say, how do we want to present our providers? How do we support our brand with that overall experience? What kind of information is unique to us that we want to put out there around our care providers? That all comes back to that overall integration of the experience. So the better structured that information is in there, the more connections and the more easily those connections can be made across the website. So as you're thinking about where on the site do consumers need to interact with these providers, having those connections behind the scenes is a huge piece of that, because we see, some patients come in, they have a provider in mind, they've been referred to a specialist, they want to see that individual, and now they want to learn about the services that are offered at your organization. Others, depending on how they've searched, may come in oriented more towards a location of care, or maybe oriented more towards a particular service line or a condition. Connecting all those dots really creates that fully integrated experience. Thinking particularly around the provider profiles and that overall provider directory experience, we've done some research into how healthcare consumers look at providers and evaluate whether they are a fit or not. And we've divided that into two areas. One is qualification criteria. These are sort of the pass-fail, where consumers filter in or out certain providers. Things like, do they accept my insurance? If they don't accept my insurance, I'm probably not going to go see them unless it's a really extreme circumstance. Are they close enough that I could get to them? Are they accepting new patients? Are there any roadblocks like that? And are they is it clear that they can treat my actual condition? Once those filters are kind of in place, consumers are looking at sorting amongst the results that are left, thinking through that more nuanced piece. Is this somebody that I'm going to like? How am I going to get along with them? Do other people trust them? What has the experience been for other people? Are they any good at what they do? And that elusive aspect of convenience as well comes into play. So these are all really useful things to keep in mind as you're planning or reevaluating maybe your provider directory experience. And the way I like to think about it is tying in those patient needs and making sure that they're supported throughout that experience, from searching and reviewing results all the way through to those profiles. So starting from the search, we can see on this example from Bronson Healthcare, they've supported a number of these questions that consumers are asking during this process. What are the conditions, or what's their expertise? Are they convenient to me? Are they accepting new patients? All of this is handled right up front during the search experience. As we think through the results that you get back from that search experience, same thing, thinking through all of these different areas that consumers are considering, and trying to support as many of them as makes sense within this interface as well. So this is where things like those physician ratings, the photos, really go a long way to helping individuals to evaluate the range of possibilities that are there. And finally, as you get into the profile itself, having robust profiles that are really consumer friendly, and again, highlight all of these different areas. It really is kind of a checklist there of what do we need to cover inside of these physician profiles at a baseline, and then certainly you can take the depth of that and ramp it up, going deeper and deeper into their expertise, into their overall, how to connect with them as a human, the likability, their endorsements, and how to get to them and how to engage with them. All of those aspects can really be beefed up. Thinking about those profiles, we've got a lot of great resources out on geonetric.com talking about writing physician profiles. It's something we've got a whole team of healthcare writers on staff that do this day in and day out, of interviewing physicians and translating that conversation with a physician into more of a narrative. And as humans, we love stories. We love to have that beginning, middle, and end, sort of that arc of a narrative. And that's something to really think about as you're crafting those provider profiles. How do you really make this picture on a web page jump to life as a human being, make that connection with the consumer that is reading that, and really convey their overall outlook? Keeping those user focused, keeping it simple, using plain language, and of course, making it easy to take action. Few interviewing tips if you're out there and you're trying to put these together. just a few things to ask that can be helpful in getting towards that narrative and really setting you up for success in writing that profile. Talking about the overall approach to care, what is kind of their outlook on how they care for patients, that background on why they chose medicine, why do they do what they do, is really compelling. What they find rewarding, what's the perk for them in providing care to patients. The overall expectations, I think you can never overdo that. I think that's a struggle we have in healthcare, is really to fully convey what those expectations are and what's going to happen and what that approach is going to be for each point of care. And just that human connection again. What are they like outside of work? How can you find something that you have in common with that care provider and start to really build that relationship? I think it's important to keep in mind, a lot of times we think about, the use cases that we think about are centered maybe around family medicine or primary care. A lot of your patients have likely been referred to specialists by their primary care providers. And so we see a kind of equal use case there of trying to figure out who this person is that they're about to go see, this stranger that they now need to trust, and how to make that connection with them. So this can be a really important part of that overall experience, that sort of transition of care towards the specialist and then back again to their primary care, is a pretty critical one. And so that content within the provider profile can really help to build some of those connections. So that touches on the bio side of things, kind of the provider bio. There's a lot you can do beyond that. And so we've seen clients and worked with them to develop a ton of different content assets. You take any type of asset that you might develop in a content marketing campaign, you can probably apply it to your physician marketing as well. And so everything from videos or blog posts, podcasts, infographics and presentations, particularly right now with a lot of organizations going towards virtual events, those are great opportunities to showcase your physicians and connect that into their profile. You can really get a sense of who somebody is and learn something that may be relevant to your condition along the way. One other area that I wanted to touch on and kind of push on a little bit is the idea of who is a provider. A lot of times, we call it a find a doc directory. You're looking for a doctor. More and more, and we see continuing growth in this area, as these stats allude to. There's a whole range of providers that patients are engaged with. And a lot of times that experience you're having in the office is as much about the physician staff, the physician assistant, the nurse practitioner that you're interacting with, the physical therapist that you're going to see, maybe multiple times a week for months. Who are those people? How do you forge that same connection with them? And where do they fit inside of your provider directory? So I think it's something to consider. It comes back a little bit to what is that overall strategy? What does your brand strategy look like? And what is the manageable scope that you can really support? But something to consider is how far outside of just the MDs that you've reached with that provider directory. And one other area to touch on, a lot of times we're focused on that digital front door, on the websites and what's on there. Really thinking about access, and particularly access to the physicians and locations in particular, as going beyond that in a way. These are seen off of your website in a way as individual businesses. Google really sees these as individual touch points and accessible businesses. And I think the important stat there is over half of Google searches we're seeing now end without any click on a result. People are finding the answers they need right there on the Google page, on the search results page, and it results in what we call a zero-click search. So somebody has searched for the physician, they were looking for the phone number, they found the phone number, they called it, they never visited your website. And so the question becomes, how do you participate in those search results, and how do you have as much control as you can over that information? And it really comes down to paying attention to that search engine optimization strategy and making sure that that is accommodated in the provider directory that you're working with to ensure that you can really key into some of those areas that are important that become part of that search results page, that you can own as much real estate on that page as possible when it comes to those results. So I'm going to highlight again, Cole mentioned off the bat, but if you joined a little bit late, we have a white paper out there on geometric.com/provider that goes into more depth and detail around evaluation criteria and really thinking through solutions in the provider directory space and how that can improve your overall digital experience on your site. I'm going to switch back and kind of think a little bit more about that patient access question beyond just finding who's available to provide care, thinking through how we, within our digital ecosystem, support some of these other areas of evaluating the care options and understanding what kind of care is available at your organization. So thinking about the idea of what is appropriate care, a few different areas that come up around that. It could be the level of care. So is this, am I in need of primary care? Is it some sort of secondary or tertiary care? Is it an ER versus an urgent care versus my primary care physician's office? The idea of clinical fit. Am I headed down the right pathway to find a kind of treatment that is going to actually solve my problem? And this gets a little bit tricky. It gets into, what is the best evidence-based pathway for that? But trying to help that consumer and educate them along the way around who can solve this problem, who's the right specialist, who's the right care provider. And sometimes that comes back to that question as well. Is this some place that you should start with your primary care provider and work outwards from there? Or is this really the kind of thing that needs to be seen by a specialist right off the bat? Where is that consumer at in the overall process? And it gets a little bit into that last area as well of financial fit. Is how does this fit in with the consumer's insurance or their payment method? Do they need a referral in order to seek this kind of care? Should they be going to urgent care rather than the ER based on where they are at and their condition, all of that? So all of these things that kind of combine together to make a really complicated problem for a consumer, especially when you're in the middle of some kind of a health crisis, to figure out what is the right thing to do. And how do we really dig through all of the options and present that? So this is a trend we've seen across clients of really laying out what are those options. And so with the recent redesign, Cone Health really worked through this within their homepage and digging into the idea of making an appointment and all of those different kinds of care and what might be most appropriate for a consumer at a given point in time. So you can see right here off of their homepage, there's a whole range of care from all the way from wellness to emergency care, sort of a gradation of care of different levels there. Lots of options, lots of access points for a consumer to be able to get the care that they need, but how do they sort through that? So as you dig in through their site, I think they've done just a fantastic job laying out what are all of those options, who are they appropriate for, what is the cost that could be associated with that, how do you actually move forward with one of these care options and get that appointment, start the visit, have a telehealth visit. And so I think this is a great way to really lay out those pathways for a consumer and allow them to compare and contrast what those options are and really highlight, sometimes it's hard to get a grasp from a healthcare organization site, the depth of offerings that are really there and all of the things that you have access to when you engage with that organization's brand. What is at your fingertips as being a patient kind of in the family of that organization? I think they've done a great job of really laying that out and providing some simplified way to compare those different options. Another way to approach finding appropriate care, a lot of times this comes back to having a human intervention in there. And that's, while we want to push forward with direct appointment scheduling and real-time scheduling, those kinds of things, it doesn't mean we should necessarily shy away from those kind of more old-fashioned, to use air quotes around that, appointment request processes that are maybe a little bit more form-based and involve a real human on the back end. That can be a great way to start that engagement, and it may be something that, depending on the particular service line or the particular need, even now in times of COVID, not really knowing what you're walking into inside of a healthcare organization, having that human interaction wrapped around that appointment request can really help with the navigation of care. So there's a lot that we can do to streamline that through online forms and workflows. We have a HIPAA-compliant form builder product called Formulate that really can handle a whole lot of different use cases around who needs to see what information and how do you process those requests for care and make sure that they're coming in and being responded to in a timely manner. So something to think about: when is that appropriate? Where does that fit best for your organization? It can be a great way to close that gap between services that are maybe not ready for real-time scheduling, but you want to have some kind of a call to action, a next step for the consumer out there. That brings us to the idea of timely care. Can I get care now? When you're hurting, when you're feeling sick, it becomes pretty urgent to get that solved. And so we see that as being a big driving factor for healthcare consumers, and certainly a big push in the market. So these are some stats around different access options that are out there right now and how healthcare organizations are using those. So we're seeing, a lot of organizations that have walk-in clinic hours. And so there's a mix here, you'll notice, between kind of operational or structural kind of what is our product offering? How can we as an organization structure ourselves to have walk-in clinic hours versus some technology types of solutions, the saving a spot or having reservation systems for urgent care. So there's a variety of different approaches, and we've said for a while that really the technology is there. A lot of it comes down to operational concerns and how do you engage with those frontline staff and make this possible and feasible from an operational point of view is probably more of the heavy lifting than having a tool to allow somebody on the website to make that appointment. Both really critical to making it successful, but important to know where some of those challenges may be. So you can see kind of the left to the right there, the things on the right are a little bit less frequently used, but I think there are areas that are definitely growing, and we're seeing definite expansion into some of those areas of online self-scheduling. It's been a big push for quite a while. So looking at that, one of the areas that a lot of organizations start is around the queuing or the wait list idea, saving a spot in line for urgent care, ER, walk-in clinics, things like that. And then the wait times has been a big trend. And when I first started working in healthcare and I heard about ER wait times, I thought that was a little crazy. And then I cut out my hand one day, needed some stitches, and it made so much sense. I wanted to know how long was I going to be sitting there bleeding in the waiting room before somebody could stitch me up and get me back out of there. And so I think it really comes back to that transparency. What is that experience going to be like? And how do we get the information in front of the consumer so that they can make a good decision about where they're going for care and how they can, go ahead and start that process right from home, right from wherever they're at on their device. So this is the area that a lot of organizations kind of dip their foot into the water in terms of allowing some kind of online scheduling. The other area that we see is that direct appointment scheduling, starting from the provider side, and having providers that are available and that patients, including new patients, can go and do that direct scheduling right through the website and engage with them right that way. So this is definitely a big push that direction. And I think probably most people are familiar with this. I think the part that I wanted to call out today, though, is this is great from a physician directory standpoint, something you should definitely be looking into. But along with that idea of connecting all those different pathways, I think what Owensboro Health has done here is really fantastic for connecting that back into that pathway coming from a specialty or a service line. So not every patient that's coming in the door necessarily knows the provider that they want to see, but many of them may have an idea around the services that they need, the kind of specialist that they're looking for. And so connecting the dots that way as well for that direct scheduling, I think is really important to consider. Just allowing more options that line up with more different patient journeys. So finally, we'll get to that last kind of sticky question around convenient care. And convenience really can vary a lot based on context. Depending on the kind of condition I think I might have or the situation that I'm in, I may be willing to drive further or really want to go to that place down the street. What is timely or what is convenient for me may vary a lot based on the severity and whether that's care for me or for my child or for my grandparent, whatever that is, it's going to really impact that perception of what is convenience. And so what's great is we have these wonderful tools now around personalization that allow you to bring more of that context into play into the digital experience. And one of the easiest ways to do that, and most straightforward ways, without a lot of people see personalization, they kind of get a little freaked out. It seems so complex and so many different options there. And I think a great starting point for that is to think about geography. And particularly as you're thinking about access to care, and geography becomes really important about what is convenient. And so by incorporating geography and personalization, using information from the user's browser or that they've shared to help contextualize the overall web experience to that particular geography, we're able to tailor that experience and really highlight the convenient aspects that the organization offers. And so this isn't necessarily about eliminating options, but more about prioritizing the options that they have. And so being able to connect that experience to physically where they're at and see, okay, this provider here that is 12 miles from where I'm at. I can make a decision about whether that is convenient to me, but I've got more information to make that decision. It comes into play as well, again, as we're thinking about connecting that overall website experience. If you're researching a service line, a service offering from a healthcare organization, and you can see those prioritized clinics or options that are nearby, the physicians that are nearby alongside of that, really starts to make that overall experience feel much more relevant to you as a consumer, and like the healthcare system really knows where you're at and is ready and willing right there next to you to support that. Along with convenience, and I think keeping on the COVID-19 theme as well, telehealth has been a huge, huge trend, and I'm sure many of you listening in are well aware of that. But in case you haven't heard some of the stats around that, Health and Human Services released some numbers that nearly half, about 43.5% of Medicare primary care visits in April were provided via telehealth. In February, that number was less than 1%, which is just a huge shift in how that care has been provided. And they're seeing that while those in-person visits have started to climb up a little bit, as far as particularly Medicare patients are concerned that they're tracking, it has kind of plateaued off a little bit. And so definitely seems like that there's going to be an ongoing shift that direction. I think as people have gotten comfortable with the idea of telehealth and seen the convenience, it's not something they're going to give up easily. And so we've seen a lot of clients work through how do we really prioritize that virtual visit as part of the options that are available right off the bat, those convenient options that making sure that that is front and center for the healthcare consumer as they're visiting the site. So this is Pro Healthcare in Wisconsin, with their recent redesign, highlighted a number of different entry points for care, one of those being the virtual visit. And I think has done a really fantastic job of all of the things that I've been talking about around transparency, understanding what that experience is going to be like for virtual care. That's something that people, that I talked to early in the pandemic had tons of questions about. What is this? What can they actually do? What do I, where can I have this visit? What are they going to ask me to do? Do I need to take my temperature, my blood pressure, all of those kinds of things? It's the new experience for a lot of people. And so they've done a great job of really laying out clearly and concisely what this is appropriate for, even down to what the costs are and what the payment expectations are around that. So it really allows a consumer to come in here, see all of those different aspects that are really important, have that overall experience, and make a decision really quickly, move forward, and actually book that appointment. So I think this is really, encapsulates a lot of where we see that patient access experience going, of really moving in that direction of clarity, of transparency, and action. So just to kind of sum up today and cover a little bit of what we talked through, starting from that idea of patient access, talked through how the expectations have really been raised, particularly during the pandemic, but overall by all the pressure from other consumer-oriented brands entering the healthcare space. Healthcare systems are under continued pressure to move forward with patient access and with their physician directory efforts. As patients are trying to find doctors, the provider directory really is a key component of that. It really needs to connect across your digital ecosystem, making sure that it ties in with those other angles that people may be looking at, the other avenues that they're seeking care through the service lines, through the physical care locations, and really balancing out that structure with the flexibility to reflect you and your brand. Making sure that we're communicating about what kind of care is appropriate, where can people start the process, what should the journey look like, and how do we help consumers to decide what is appropriate care, both from a clinical perspective as well as a financial perspective. That timely aspect, pushing on real-time scheduling and different pathways into allowing patients to take action and get in and be seen as quickly as possible. And then the idea that personalization is one way forward for the idea of convenience, that really contextual idea of convenience, allows a number of ways for us to tailor our communications to the individual and communicating about what is convenient in their particular situation. So with that, we've left a little bit of time for questions today. And I think while we do that, we can leave a little bit of time. If you have a question and want to put that into the question box, we can take a look at those.
Yeah, thank you, David. Had a couple questions here about some third-party review sites and kind of so talking about Yelp or ZocDoc, Google My Business, things like that. How do you recommend marketers approach those sites and their provider profiles on those sites versus their own website where they have more control?
Yeah, there's definitely a huge range of sites out there that have your physicians with stars next to them. And what do you do about that? We've seen over time, I think the strategy that a lot of healthcare organizations have trended towards is really trying to own a quantity of reviews. And a lot of them are using those patient satisfaction surveys to drive that. And that allows you a great volume of reviews, which is really critical and something, as we've kind of researched through other industries, what makes consumers click, what makes consumers engage with other products. Those larger numbers of reviews and certainly larger numbers of positive reviews are seen as more trustworthy, and it's a little bit of the more the better at some level, and so that's kind of the approach and strategy we've seen a lot of healthcare organizations take, and by doing so, for one thing, it creates this sort of virtuous cycle that if you have a high-ranking page with a huge number of great reviews on it, and it starts to get more clicks based on those reviews, that Google sees that as a ranking factor that's going to kind of encourage that to continue to be moved towards the top of the results. And so by doing that and building that overall across your site, a lot of organizations have really worked to try to bury some of those other sites. And so that's kind of one strategy there. I think also, certainly people have a limited time in their day to, you could go around and try to manage all of these different things, but there is value in being responsive to reviews that may be on those third-party sites, and making it feel like the garden is tended there to some level. So it's really, a balance of how much time and effort can you as an organization devote to that, but at a baseline level, if there are particular reviews out there on Google My Business or in some of those third-party directories, it can be valuable to at least have a basic response in there. But I at this point, I think would encourage most organizations to really own as much of those reviews as they can.
Great, thank you. Again, an additional reminder, if you do have a question for David on anything that we covered today, enter that into the questions box within GoToWebinar, but we'll kind of throw in, as we're waiting for some stragglers maybe to put their question in, did just want to again mention next month's webinar where Ben Dillon will be going over some of the initial findings and trends that we're seeing coming out of the data and results from our 2020 Healthcare Digital Marketing Trends Survey. So if you're interested in marketing and the future of healthcare marketing and things to look forward to in the coming year around healthcare marketing, I would recommend signing up for that. Also, again, just hammering home that we do have that white paper available for download that talks about provider directories and some key things to look for there. And that is available at geonetric.com/provider. And I went out of order a little bit, but circling back to the survey, we do have that wait list open right now if you want to sign up to get those results emailed to you when they are available in ebook format. Do have a question here. How important are clinical interests, and how do you start in developing a list of taxonomy terms for the system to select for doc profiles?
All right, that one includes my favorite word, taxonomy, right? Yeah, the clinical interest, I think, is a great opportunity. When you're looking at a whole set of, dozens of cardiologists or dozens of family care providers, how do you find the one that really matches you? And so I think the clinical interest provides, a deeper level of that. It starts to give you a sense of who that person is professionally, and it also gives you some great keywords for optimization as well and for searching on. And so as you have the opportunity to really take advantage of those, I think it's while it's maybe not the number one thing to go at, I think if you have that information and can make that into compelling user-centered content, that's something to definitely include. As far as the taxonomy terms, when you're setting that up, that is, has a special little place in my heart. So it's really a key piece of that user experience process. This is the navigation throughout that entire directory. It can really drive the browsing and search experience for finding those physicians, for finding different kinds of care, and for providing that patient access. And so it's important to keep in mind there may be some differences between, again, that internal language and the consumer-oriented language. There may be instances within the provider directory. Sometimes we're balancing some more regulatory or legal or organizational requirements. Things like board certified specialty is a great example. That just is what it is. You just need to have that accurate information. It doesn't necessarily communicate that well to a consumer about what this individual does. And so having alternative approaches that allow a consumer to use their own language, terms they may be more familiar with, and terms that are at the right granularity for the providers that you have is an important part of that process. So it's always a it depends kind of process for developing that taxonomy. If you've got a few dozen providers versus thousands of providers, your taxonomy is going to look a lot different. But at the core, the idea is what are those terms that your patients and your consumers are actually using? Great sources for that are your search console and on-site search, just looking at the terms that people put in and the language that they use around that. But certainly engaging with somebody to help you through some of that user experience research and has some background there can be really helpful as well. Awesome.
Right.
Well, thanks everybody for your attention today and all of the great questions, and look forward to talking to you again soon.
Yep. Thanks, everyone. Have a good day.